I'm John Vozenilek. I'm the Chief Strategy Officer for SIMnext, which is a healthcare innovation company. And we're right here in this heart of Chicago doing healthcare innovation. Matter is an incubator for healthcare innovation, located right here in the Merchandise Mart. So I would tell you that certainly there's no better way to learn anatomy by studying the human body. And certainly there's a rich educational value to studying anatomy in that way. Our company uses advanced technology to replace the human body with phantoms, so devices that are operated by computer, that produce lifelike signs, that produce high fidelity interfaces so that people can learn better without actually having to use a human body.
Now, are these medical students?
So our focus is practicing physicians and nurses, advanced practice providers. Our basic premise is that there's an expanded number of new provider types out there in the community to really serve the need of healthcare in the future. And we've got to use the latest technology to make sure that they're trained to the very best standard. So our focus is on low-cost technologies that are available to the provider so we can enhance their education. If you're a physician or a nurse practitioner out in the community, you can afford an ultrasound machine, but you may never have been taught how to really use it best, to make the best diagnosis and to make it accurately. So we build lifelike body parts using all kinds of silicone and all kinds of interesting techniques in 3D modeling to reproduce the human condition so you can pick up those physical examination skills. So for example, the traditional way to teach a nurse these days is you bring them into a lecture hall and you sit them in front of a PowerPoint and you teach them. And that's just not adequate. Because what's really happening for the nurse is that they're interfacing with all kinds of mechanical devices. They program smart pumps, they program ventilators, they work with dialysis machines, and it's really a human interface. Well, our tablet-based curriculum trains a nurse to learn how to do it right, to do a safety double check on the tablet, right at the patient bedside, right at the moment when it's most important, and gives them feedback immediately, and verifies that an order is going to be deployed correctly when they do it for the patient. We've learned that about 1 in 5 times there's small errors that occur. And the problem is those small errors, sometimes they affect patients. Most of the time they don't, thank goodness. But when they do, the result can be quite devastating. The theme here in Illinois with this new medical school is this is a massive opportunity to think differently about what medical education can produce. And this particular medical school down in Urbana-Champaign will be focused on the idea of healthcare engineering. So bringing people from an engineering background into the context of medicine to really redesign healthcare. So these graduates, they may practice medicine, but they'll be properly trained to redesign healthcare, design new processes, new devices, new technologies, so that they can really transform healthcare in the future. And that's what the University of Illinois is seeking out of that new medical school. When I went to medical school, one of the most incredible encounters for me was the encountering of my anatomy experience, and that was done over a human body. And that was a very important experience for me because it really transformed me from a usual type of college student into a medical student. Now, imagine if I had an engineering background and I was in this context, how I would redesign the learning of anatomy. Think about all of the massive technology we have to do imaging these days with 3-dimensional modeling, with MRI and CAT scan that could reproduce human anatomy to a great deal without ever having to actually slice into a human body. We could totally redesign the way that people learn about how human organ systems work. I mean, that's just one of the simple ideas that could come out of such a medical experience.